Am I audible?
Yes.
Okay. A very good evening to everyone present. A very warm welcome.
1 second. Yeah, we'll start the session now.
Gina,
Okay.
would you like to start
So,
and hand it over to me?
I'll start it now. Okay.
Yeah. Thank you.
Thank you. So welcome all to Vayomanasa Sanjeevani's webinar series. I welcome all the YouTube Zoom participants and our resource person, Dr. Vasudha Rao ma'am, for today's session, and our moderator for the day, Annie Matthew ma'am, for today's session, stress in elderly. Before we start the session, I would like to show a video on Vayomanasa Sanjeevani.
Being a leading center in the country for clinical services, training and research, National Institute of Mental Health and Neurosciences has been settled up with specialized center of access to senior citizens. The Geriatric Clinic and Services works exclusively with elderly population to promote mental health and overall psychosocial well-being through multidisciplinary team approach. Population aging is emerging as an important challenge globally as well as for India.
Ma'am, is the audio there? Ma'am, is the audio not available? Okay.
No.
Still it's not there, right? Okay. I'm sorry for the technical glitch which we have faced. So I would like to welcome our moderator, Annie Matthew ma'am, for today's session. Introducing her, she is a volunteer of Vayomanasa Sanjeevani. She has completed her PG in diploma in counseling psychology and currently pursuing her MSc counseling psychology from Shillong. She was working as a quality coach come behavioral skill trainer in DE's BPO division in Hyderabad. And she was also working for counseling for youth and youth married couples for 6 years. And she herself is a caretaker of her father-in-law since 4 years, who is suffering from Alzheimer's and dementia. So that is the introduction for our moderator, Mrs. Annie Matthew ma'am. Welcome, ma'am, for today's session. Now I request ma'am to address our speaker for the day, Dr. Vasudha Rao ma'am. On to you, ma'am. Thank you.
Thank you so much, Gina. Am I audible?
Yes, ma'am, you are.
Thank you. Well, a very good evening to everyone present here. A warm welcome to all our participants on the forum today. Thank you so much for making time and coming. A special welcome to our speaker for the day, Dr. Vasudha Rao. Let me just take a few minutes to introduce Dr. Vasudha to all of you. Dr. Vasudha Rao is a psychiatrist and a psychotherapist with a great amount of experience backing her, 13 years to be precise. During the early days of her career, Dr. Vasudha had served at DARE Alcohol and Drug Rehabilitation Center in Bangalore as a de-addiction consultant. She also served as a consultant psychiatrist in various institutions like Shekhar Hospital, Maharaja Agrasen Hospital, and Devagiri Hospital in Bangalore, Kristuraj Hospital in Kannur, Kerala, and is currently serving as the consultant psychiatrist and psychotherapist at Viveka Clinic, Mysore, and also at Ionia Mind Virtual Clinic. She's a psychiatrist by profession, and she chiefly works with adult psychiatry and psychotherapy. She's a psychiatry awareness enthusiast and is interested in using design and social media to create public awareness on mental health. Her areas of expertise are adult psychiatry, adult psychotherapy, CBT, and addiction. A very warm welcome to you, Dr. Vasudha. Over to you now. Thank you.
Thank you. Thank you. I'm very much honored that I was invited, and I have getting an opportunity to do what I really love to do the best. That is to create awareness about mental health and to take it to more and more people in our country. So today's topic is, since this is a geriatric mental health initiative, so I will be talking about stress in elderly. So shall I start sharing my slides?
Yes, ma'am. Go ahead. Thank you.
Right. Are the slides visible? Okay.
Yes, ma'am. It is.
Today's topic is a very important topic, although it is very common and often talked about. But this is an area where much needs to be done and said and known. So this is the topic is stress in elderly. So going to what is stress? Stress is an uncomfortable and unpleasant feeling in the mind and the body whenever life throws a challenge at us, whenever there is a change in our life, and whenever there is something we have to adapt to. That is what is stress. So stress has the physical component and the psychological component. So stress is a bodily response, we can call it. So definitely it affects the brain and the body, various organs in various ways, as we will see in the forthcoming slides. So it is a feeling of emotional and physical tension. Like, a person is not relaxed. A person is feeling something which is constricting him. So that is a feeling of stress. I am sure all of us know this feeling one time or the other in our life. So it can come from any event in our life or one's own thoughts about a particular situation. For example, the pandemic, which was out of our control, and that was a global event to which the whole world responded with stress. So there was stress on various levels. So it is a body's response to a challenge or a demand placed on us. So what are the types of stress? There are three types of stress. One is acute stress. The second one is acute episodic stress and chronic stress. Acute stress is when we are faced with a small challenge. For example, a person who is driving a car newly, so the person has to drive for some distance alone without probable assistance. So the person might feel stressed at this challenge of driving by himself. So that is acute stress. Then acute episodic stress, we can easily give an example of a firefighter. For example, whenever there is a call to the fire station, whenever there's a fire in the city, so the person has to step up and act at the call of the emergency. So that can be a good example for acute episodic stress. And chronic stress is a stress which does not seem to abate so easily. It goes on for a prolonged time. For example, chronic stress can be up from a chronic illness, somebody who's suffering from a chronic illness. So the chronic illness leads to chronic stress. So there are three types of stress. And I would like to emphasize here about acute stress. Acute stress can be mild and acute stress can also be very severe. For example, being in an accident is something which can be categorized as severe stress. And losing a loved one So that is also a severe stress. Sitting for an exam, facing an exam, so that can be a milder acute stress if you do not have exam anxiety. Otherwise, that will also feel like severe stress. So getting married, so that is also a form of acute stress, right? So I'll go on to the next slide to see how does body respond to a stressful event. Since I have already outlined that this is a bodily response, it would be very interesting to know how body responds to a stressful event. So what happened when the lockdowns happened in our bodies? So if you take that example, so the stress response system is a homeostatic system in our brain. So whenever there is stress and there's a stress response, the hypothalamus acts in producing the hormone ACTH, that is adrenocorticotropic hormone. This is a signaling hormone to the adrenal glands. So when this hormone reaches adrenal glands, it will produce adrenaline and cortisol. I am sure most of you would have heard of the term adrenaline rush. Okay, that is what we experience when we go in a very fast car, or when we are in Wonderla, or when we are going in a helicopter or something like that. A nice form of excitement. So that is also when adrenaline kicks in, and cortisol also kicks in because there is uncertainty and there is a sense of danger. There's a sense of something going wrong also in exciting activities, isn't it? So the cortisol is also a hormone which is secreted at the time of stress. So what exactly these two, twin brothers, the stress response brothers, what do they do to our body? One is they get you ready for a fight or flight reaction. For example, if you're going in a very fast car and suppose you're abducted, so either you have to fight with the person who's abducting you, or you have to open the door and jump out of the car. So you have two choices, fight or flight. So the body is readied for these two responses. So what do we need when we want to run or fight? So we need more oxygen. So definitely there is a dilatation of bronchioles in the lung, and the heart tries to pump as much blood as possible to the periphery so that there's a lot of blood supply to your legs. You can definitely run. And then what happens is we need glucose. We need energy to do all these activities. So the glycogen, which is a short duration, food which is stored in the liver. So that is easily broken down to glucose molecules, and you have the same rushing as if you drank a glass of Glucon-D just before you are running from your abductor. So that is what the liver does. Then what happens to the gastric activity? So when all the blood and the oxygen and the glucose is being diverted to your legs and hands, so there's not much left for the digestive system. If you have eaten the Ugadi Obbattu and you want to digest it, so that is not the time when blood is streamed to your gastrointestinal system. So whenever the system is activated, whatever blood is there, they're being diverted to the gut is generally cut down, and it is redirected to the periphery so that you can either fight or run. So the blood pressure definitely increases because the heart is trying to pump harder, right? So the blood pressure also increases. So this is what happens when we are stressed. So whenever there is an action, there should be an opposite reaction, isn't it? The laws of physics. So something like that applies to this physiologic system. So how does a body relax then? If we are stressed, it's not a very pleasant state to be in. We feel constricted, we feel very uncomfortable. So we would like to know how the body relaxes. So the body has an inbuilt system called parasympathetic nervous system. So it is a part of autonomic nervous system. So we say automatic because you don't have to really think. It kicks in on its own, just like the stress response kicks on its own, right? So what does this system do? So it puts you in a state of rest. What happens is it constricts the pupil, stimulates the flow of saliva. It constricts the bronchi so that you can calmly and very slowly breathe. It slows down the heartbeat. And it also facilitates the digestion of the Obbattu and the non-veg from the recent Yugadi. So there's a good amount of digestion which can happen in the relaxed state. So what do we do in festivals? We have good food And generally we have a nice siesta nap, right? After that. So that, we are in the parasympathetic mode for the entire day. Liver, what happens to the liver? So when there is so much secretion going on, the job of the liver is not to release more glucose into it. Already there is glucose from the OBA2, right? So it stimulates all the bile enzymes to digest whatever food is being ingested in a state of relaxed, calm, and a happy state. And what happens to the kidneys? So the kidney secretes urine, and this contracts the bladder, and it also has effects on the pelvis. So as you can see, stress is not really limited to the mind and the brain. So when the stress response system and the relaxation response kicks in, so it affects the entire body. So that is what we need to understand. So we are coming to our target population here, the population in focus, that is the geriatric population. So what are the sources of stress for elderly individuals in our society? The most predictable stress is retirement. Everybody knows that they are going to retire from service when they are of a age regarding that country. Every country has a different age. So definitely retirement is very stressful because it brings about changes in many, many areas of life. Financial status after retirement. So without a steady income coming in every month, so older people can have difficulties on that front. Caring for grandchildren. So nowadays, because the families are nuclear, grandparents usually go for the delivery and the post-delivery care of children and daughters-in-law, and they go abroad for this purpose. So caring for grandchildren can be a very big challenge for people who are already having medical issues, even otherwise, because it's a very intensive job. Caring for sick spouse and siblings or parents, disabled adult children. For example, if a person is about 65 years old and he has a father of about 85 years old or 90 years old. So although this person is himself aged, he is supposed to care for his elderly parent. So this places additional burden on elderly people. And we have seen parents of disabled adult children, for example, those with mental retardation, those with various physical disabilities, and differently abled children who need assistance from their parents even after they become adults. So this places stress, this places a burden on the elderly. And as we know, our body and mind slow down when we grow older. We are at risk of many physical ailments. We are at risk of many chronic illnesses. So deterioration of physical abilities and chronic illness can be a major source of stress. Other worry about being able to live independently, because we all would like to be independent and not depend on others, at least for daily activities in our life. So that becomes a challenge if one is suffering from conditions which prevent such independence. And also worries about institutionalization. Suppose the children are not here, or children are not able to support them, or there is no family left behind. And as people grow older, there can be new appearance of interpersonal problems, or there can be an exacerbation of existing interpersonal problems within a family, which gives rise to interpersonal stress. So what are the common manifestations of stress? How do we know that we are stressed? That is the question, isn't it? So stress can manifest in various ways, like poor sleep, decreased appetite, frequent urination, upset stomach, indigestion, diffuse body ache, and worsening of blood sugar and BP control. A previously well-controlled blood pressure may shoot up when there is an acute stress in any life event. And also tiredness, not feeling like doing the daily routine in the way one used to do before. So that also can be a sign of stress. And in some, there can be also restless movement. They cannot sit in one place. They keep thinking about it. and they want to problem solve about whatever stressful situation that is. So it can lead to a lot of restlessness also. As it can lead to decreased activity, it can also lead to increased activity in different individuals. And what are the psychological changes which come with stress? So feeling very pressured to do something about what is worrying one person, and feeling very restless, feeling anxious, feeling fearful, and having a low mood, suffering from poor concentration. For example, elderly women usually complain in the clinic saying that they're not able to plan their cooking for the day. What is the menu for the day? And they get confused, they get stuck up with what kind of breakfast they would like to cook for that day, and it takes forever for them to plan what ingredients to keep ready. So these are examples of poor concentration and poor ability to plan. So all these abilities can be affected by stress. And also one can feel like, not sticking to the normal routine. Sticking to a normal routine in a disciplined fashion may become very difficult, that is if one is very stressed. Another is crying spells and increased anger. Crying spells sometimes, one may not have a good control over the mood if the stress is overwhelming. For example, loss of a close friend, which is a very stressful event. So this can manifest as crying spells. And also sometimes, emotional upset can manifest as increased anger and irritability. What happens to the memory? So the person may become forgetful of small things which they used to perform very well earlier. So remembering small details would become difficult. And this is independent of the dementia syndrome. It is not that they are suffering from dementia, but the stress itself can lead to poor working memory. And the person may feel that they are unable to relax, and their mind is constantly running a to-do list. It's never over, right? And or there are people who have a lot of time on their hands. They don't know what to do with it. So they feel very stressed, that they're not doing anything. They're not being productive, or they're not able to do something useful for their family. So the thoughts really bother them and they're unable to relax. So what are the effects of stress? Now we saw the manifestations of stress on a physical level and also on a psychological level. So now if we see what effects does stress have on the elderly. So as I have already delineated a few of these, for example, upset stomach and the precipitation of heart disease or acceleration of heart disease. For example, if a person had a small plaque in his coronary artery and there is a prolonged period of stress, for example, loss of a spouse or loss of a close friend or a dear neighbor. So when that stress kicks in, the person is more prone for worsening of the atherosclerosis or the blockage. And increased blood sugar levels, we all know that diabetes is intimately connected with stress levels, including onset, progression, and its chronicity and the severity. So increased blood sugar also can indicate that the person is very stressed because of any life event or situation. Poor control of sugars. For example, the person is getting treated with oral hypoglycemic agents or insulin, but then the doctor and the patient really struggle to get the sugar under control because there is a baseline level of stress and the cortisol usually kicks up. And cortisol, what does it do? It generally breaks down all the glycogen and converts it to glucose. On top of what the person eats, there is a gluconeogenesis happening from the liver. So it keeps adding to the glucose levels. So this usually leads to poor control of sugars despite the best efforts of the physician and the patient. This can also lead to increased lipid profile, for example, increased cholesterol. Because one is, there could be a pattern of stress eating where one wants to eat comfort foods. Okay. For example, fried foods and very oily foods, which are comforting, which are crunchy, right? So this can also lead to such behaviors, and stress in itself, cortisol by itself can lead to dysregulation of the lipid profile. And the memory problems can occur, like, the person is very forgetful, independent of having no diagnosis of dementia. So the memory problems can occur during a period of stress. And this can also progression to depression. So here it's very important to understand what is the difference between stress and depression. Stress, as I have outlined, it has so many manifestations, but depression is definitely, characterized by low mood. It is characterized by fatigue, and it is characterized by loss of interest in activities that one used to be interested in. For example, if a person is very much interested in listening to radio or very much interested in watching movies on TV, right, or YouTube, but the person doesn't want to do those things, then the depression sets in. And also there is a duration criteria to diagnose depression, and the duration criteria with all these three major criteria is about 2 weeks. So if there is a persistent low mood for about 2 weeks, you're not able to enjoy anything, you're not able to experience happiness for about 2 weeks, then ideally I would recommend you to see a professional for various kinds of interventions. So the depression is different from sadness, because sadness is a emotion. You just feel sad, and if you do something, or if you indulge in something else, like watch TV or talk to a good friend or go for a walk, you will be able to modulate your mood a little bit better. It is not so persistent. But when the mood is persistently low for about 2 weeks, especially with early morning sadness, it is definitely depression. And there's another clinical condition which is associated to stress and acute stress reaction, which is PTSD. PTSD happens when there is an overwhelming trauma to the person. For example, in this population, for example, elder abuse. There is a family member who has abused his elder in a violent fashion, either verbally or physically or sexually or financially. So that leads to a particular trauma response from the brain. And when left untreated or unsupported, this can easily progress to PTSD. That is a post-traumatic stress disorder, which is a more chronic disorder where the person experiences persistent anxiety. So it's very important, as you can see here, to identify what it is, whether it is stress, whether it is, sadness that we are all familiar with, a passing mood, a passing low mood, that is sadness, or depression, that is a persistent low mood where the mood refuses to budge, the low mood for about 2 weeks, or a component of PTSD which develops after acute trauma, like witnessing an accident, being in an accident, undergoing being a victim of violence. So that can lead to post-traumatic stress disorder. So what are the myths regarding stress? So definitely there is so much material available in the social media and search engines and also newspapers. Now everybody is talking about stress, especially after the pandemic, because it has multiplied the mental health problems in this world. So everybody is to a degree aware of what stress is. So the biggest myth is that one can lead a 100% stress-free life, because life keeps on bringing us challenges, and challenges will lead to a stress response, but it need not be negative always. For example, if there is an exam and I am a person who's very much interested in the subject and I study very hard for it, but I'm stressed during exam time, but I feel that it is going to give me a sense of accomplishment if I clear the exam. So it is stress. It is a good amount of stress. So in that stress, I make more efforts to study. I will put in more time into studying. I will organize my day. So I will use this stress in order to create a positive outcome. So there is always stress. Even happy events are stressful. For example, marriage, which many people view as a very welcoming event. It can be very stressful because there is a period of adjustment. There is a period of interpersonal, getting to know each other, using conflict resolution, getting adjusted to the family, getting adjusted to the new role of a wife or a husband or anything. So this can happen in the case of retirement in the elderly population, where their roles might change. For example, a very busy man and a very punctual man who works from 8 a.m. to 8 p.m. If after he retires, there is always obviously a question, what he is going to do with those 12 hours? How is he going to structure his time with all the free time on his hands? So this, although retirement really was necessary for him, considering his health, everybody, including his children, told him, you got to enjoy your retired life. But then it can be stressful. The adaptation time can be stressful. So life can never be stress-free, but we can learn effectively how to manage it, handle it, and minimize its effects, negative effects on our body. So that is what we can do. So if one is very stressed, the second myth is if one is very stressed, they don't know how to handle it, or they're very weak psychologically, right? But that is not the case. As we saw, everybody has the brain and the adrenal system and the hormones. So we all get stressed from time to time. It is not a testament to one's weakness or strongness or resilience. So stress response is a normal fact of life. So it doesn't mean anything about the person. And many people believe that stress is only psychological, that they feel restless and they cannot relax and they can go away with one night's sleep or whatever it is. So it is only psychological. They can just remediate psychological, which is not true. When the hormones, stress hormones course through our body, every inch of our body is influenced by the stress hormones. And there's also one thing that, if you can attend a small stress management course or a small, any intervention for stress, it is going to go away permanently. But stress management actually means, long-term life adjustments where we learn skills to handle repeated stressful events in our life. So it requires practice. It also requires learning, and it requires adaptation of these learning to our personal life on a daily basis. It is just like exercise, or it is just like bathing, like what Zig Ziglar says. If you don't bathe every day, bathing you have to do every day, right? Only then you remain fresh. You cannot say, okay, I bathed last week, so why am I not fresh now, right? So you got to do this every day. Stress management is an everyday thing that we have to do. And many people believe that all stress can be mitigated by the individual alone. For example, if there is somebody who is telling their troubles to you and you feel that, no, you should deal with this differently. You should deal with this differently. For example, workplace stress, or living in a violent home, or living in a very conflicted home. So when we place the entire onus on the individual, we are not appreciating how the context of the individual really influences the individual. For example, if there is an elderly person who is living in a home with weak supports financially, right? He cannot just use his willpower to get over the stress. There needs to be a practical solution, or there needs to be an institutional solution or a governmental solution. So there needs to be a systemic context in which we view the individuals. So never say that, okay, if you're very stressed, you're not doing it well. You got to manage it on your own. So that doesn't hold true. And there's the other, there's the other facet of the same myth that all stress can be mitigated if others or situations change. For example, if I live in a different city, I'll be much happier. It's possible, but it's not the city alone, isn't it? We have some control over our own responses. We have some control, not everything, right? If one is in a very, very busy workplace and one feels very stressed with that busyness, right? And one cannot change the organizational culture on many occasions. So it is a systemic factor which is stressing the individual in that context. And many people think that elderly should have a relaxed life, hence they should not get stressed. But we know for a fact that elderly have many stressors which keep coming, like how I outlined. There is stressors from the work life, there is stressors from the personal life, and also health, mental health areas. So there can be many stressors which can add on in the elderly. And many people believe that retirement is relaxation, but actually it is an adaptation, right, from the working life to the retired life. So the person has to find purpose, meaning, routine, and structure in his retired life. So until that adaptation happens, it is a stressful phase. So the context of stress, as I have already outlined, it depends on the individual. It also depends on the family the individual belongs to, and also to the larger systems like the village or the city or the governmental facilities. Whichever systems which are supporting the elderly population, it depends on all these systems. So the individual contributes to the stress. There is a family contribution to the stress, and also the larger systems, the context of the individual, that also contributes to the stress of the individual. So it is not the individual alone. So when we think about stress, like what areas of our life, I have almost outlined most of it, but if you think about it in the terms of gears, it will be much easier for us to reflect upon what is stressing us out. For example, there is an area of the self, the personal, what kind of a person the patient is, and what coping mechanisms he used earlier in his life, in his younger days, and how it has changed now. What was his situation earlier and what has happened now? So how is he coping? If he has a few coping mechanisms, are they working now? For example, an elderly gentleman who was driving a car, he met with a minor car accident. It did not maim him in any way, but then it created an anxiety that he may meet with an accident in the future also. So if his coping mechanism is avoidance and he doesn't go and again drive a car, so it's an avoidance coping, isn't it? So what happens is his life, again, he will have to depend on auto rickshaw, Ola, Uber, or children who can drive him to various places. So that will create a different dynamic in his life where, his personal coping will affect his levels of, ease in living. So the same thing happens with work. For example, after a retired life, if the spouse, if the lady of the house, in our society, the maximum amount of household chores is done by ladies. So suppose the lady develops an arthritis, or the lady develops a Parkinsonism, where she cannot grate the coconut, where she cannot cut the vegetables. So what happens in this front, even in old age, people have to keep working at least in their house. So if they're not able to do it, it is a source of stress. For example, this lady may slip into a stressful phase where she says that I'm not being productive to my family. I'm not able to cook good food for my family. So the work also can be a contributor. And the relationships, we know that this is a major component in families and the elderly. We know that it is a really important factor where good relationships can double the happiness, and conflicted relationships can be very, very troubling and very they can impact negatively on physical and mental health of the elderly. So in this area, the interpersonal dynamics, like not only the elderly person, but what about his son, or what about his daughter? Suppose there is a son who is alcohol dependent and he comes home drunk every day and he asks father for money, and father has to give him money out of his pension, right? So it is not only this person who is responsible for his stress, right? That there is a relationship which is contributing to the stress, right? So these are the gears which work together. And what happens is, suppose there is a relationship problem going on and this person is going to work, definitely the stress response will show itself in the area of work, or it will show in the area of self-care. For example, this person who is giving pension money for alcohol, this elderly gentleman, he may not take care of himself by exercise or adequate relaxation or socialization. He may want to remain lonely because everybody asks about his son who is an alcoholic, right? So that impacts his life in a negative way. So one area definitely impacts the other area. So they work like interconnected gears with each other. So now we are coming to how to manage stress, where I'm sure you would have got a lot of advice in this area, right? So I will add a very practical, a few practical points to this. It is very important to identify whether you're stressed. For example, many elderly people, when they come to the doctor, they want the BP checked up, they want the sugar checked up. And when we tell that the BP is higher, they cannot recognize that it is because of stress. Right? So the first step is to identify that one is stressed, and also accept that it's a bodily response. It is not something that, you say, I shouldn't be stressed. I should be always calm and relaxed like a yogi on the Himalayas, right? That's an ideal. I mean, yes, if we are like that, well and good, but it's an ideal that we want to reach. It's only an ideal, right? So it's a bodily response. Everybody gets stressed, and it's okay that we are stressed. So there's a level of acceptance which we need. and identify different factors which are contributing to stress. For example, if you think about these gears, if you go back and remember these gears, so just think in your mind, like what is the area which is stressing me the most? Work, health, relationships, social factors, right? So these things. So reflect on what you can control at the individual level at this moment. So a lot of elderly people during the time of Corona, and I used to get a few calls. Initially, we were on some helplines. So the call used to be generally about, they're lonely at home, they cannot go out, and they're watching a lot of TV, they're feeling anxious. What can they control? Probably watch less news and do something which is more conducive for their health. So that was an advice which was given to that situation. Like, don't watch too much news, because the news had become almost a continuous thing about catastrophes, right? So that is what you can control. So focus on what you can control and always accept what you cannot control. For example, if you have a health condition, osteoarthritis, and it is limiting your movement, and you're constantly struggling with it, you're constantly thinking about it, right? And you have not found ways to circumvent some of the difficulties, right? It's also important to accept that you will continue to have some difficulties in the area of movement and knee movement, right? So work out how to make changes to factors under control of self. For example, if one feels that the increased blood sugars are because of stress, one can definitely make changes in the diet, and one can also make changes in the exercise levels so that the blood sugar levels can be normalized. And the most important thing is always to implement all the changes that you want to implement. Doing is very, very important than planning. Planning is important, to plan well, but then execution is what is very important, right? So doing is better than perfect. So you don't have to do anything perfectly. If you have decided to do 10 Surya Namaskaras today, and even if you do 5, even if you do 2, that's fine. But it's much better than doing 0 Surya Namaskar, right? So doing is better than perfect. You may not reach your goal, but you go ahead and do whatever it is that you set out to do. This is the best way to handle stress. Practically handle the factors you can control. You can also remember these 4 factors. Burn is make changes in your behavior, make changes in your exercise routine, learn relaxation techniques, and keep a good nutrition profile. If you have any chronic disorders like diabetes, kidney disease, so there are specific diets for this. There are a lot of professionals for this. You can also ask your treating physician as to how you can maintain healthy nutrition. So it's okay to give in to cravings at some points, but not feel guilty about them. That is also very important, right? You cannot be perfect, but it's good to maintain a healthy routine in your life. So if you remember BERN, so these are the 4 pillars of stress management: behavior, exercise, relaxation, and nutrition. So coming to behaviors which can lower stress, that is asking for appropriate help from whoever is available, willing, and you find approachable. It's very important to ask for help. I think this is an area where seniors really struggle to ask for help from their adult children, from their neighbors, and asking for help somehow feels shameful, but it is not. Human beings are not born independent. They don't live independent. We are always dependent on other people. So generally I ask people who are very much stressed about independence, I ask them, are you making your own toothpaste? Are you making your own soap? No. If we have to lead a single day of life, we have to depend on thousands of people who are supporting our life. So it's okay to ask for help. It doesn't make you smaller. It doesn't make the other person much bigger than you. There's no shame in asking for help. And seeking social support in times of distress. For example, if you have lost a spouse, or if you have lost a close friend or a very good neighbor with whom you used to have a chat every day. So it is very important to talk about this. It is very important to seek support from children or friends or relatives, whoever you find approachable and comfortable. It is okay to talk about your problems, right? Then indulge in pleasurable activities, hobbies, Nowadays, I'm seeing a lot of old people on Instagram and Facebook who are doing amazing stuff, who are doing learning dance, who are into painting, who are into stitching and crochet. So there's an unending list of hobbies that you can take up according to the physical fitness levels. All right. Somebody with rheumatoid arthritis, crochet might be very difficult. So you can choose something else which suits you, right? Also indulge in a lot of movies, music, anything at all, anything you like. And seeking out friends old and new. I do not know how many of you have seen the Gandhi Bazaar main road, where every evening a group of seniors come and sit and just chit chat and go. It's a very busy circle, but every day people come for their friends. So it's very important that we maintain friendships, old and also new friendships, make new friendships, either in the park or in the class or, in the church or in the bhajana mandal. So it's very important to have a social circle which can cushion you. And with all the time and effort that you are capable of putting in, helping the less privileged, teaching children, or any way you can contribute to the social betterment, that is also positive for mental health. And financial assessment and planning, this is the most important part, because this is where a lot of elderly people in our country struggle. So financial assessment of your current resources and how you need to preserve those resources, or what you need to do to build on those resources. So this planning is very important. You can seek the help of a professional if you feel like it. And learning new skills at any age is possible and doable, and it's very healthy. So for example, a lot of ladies try out a lot of new different recipes, and they add to their cornucopia of dishes, right? So they appear so happy doing all these things. And I've seen seniors jogging, seniors into laughing club and yoga, and any new thing that you can do. And people who learn new languages at an older age. So this can also boost brain power and keep you healthy. Working on repairing relationships, this is the most important, one of the most important aspects, because all the other above factors are about the individual's efforts, but working on repairing relationships, it addresses the relationships at home, like what kind of relationship you want to have with an adult child. So what you need to adjust, you can't treat this child like a 3-year-old. You can't tell them so many things like what you told them in their childhood, right? You adapted to their teenage, now you'll have to adapt to their adulthood, where they themselves become head of the family, right? And they take care of you like as if you were their children, right? So the dynamics change over time. The power dynamics in the family change over time. And the more clear the communication, more the assertion, like what you want and what you don't want, what you felt and what hurt you, what made you happy. So clear communication about your needs and wants can lead to healthy relationships. And also acceptance of limitations of other people, like, younger generation. And the younger generation accepting the limitations of older generation. For example, my mother is not able to look after my baby any longer because she's really getting old. She cannot see properly, or her knees are really painful. She cannot run behind the baby. Acceptance of the conditions as we go through life on both ways. Younger generation in the family accepting the older people, and older people accepting the younger people. So this mutual understanding, respect, and love will lead to healthy relationships. Exercises, I think all of you definitely know about it. I'm not going to go into it because I think there's so much literature on this: yoga, stretching, weight training. I would like to emphasize on weight training. If you are an adult, older adult, kindly consult a doctor and see if you can do weight training, like 1 kg or 2 kg weights every day. Not too much, not like bodybuilders, because it preserves your balance, it preserves your flexibility, and also muscle mass, which is very important for your movement as you go through life. Right? Even swimming is very good for muscle mass. Coming to relaxation exercises, breathing exercises, breathing slowly in and breathing slowly out to the count of 4. So this can be very helpful in the moments of acute stress, like, when there is a conflict happening at home and you're feeling very upset. And if you say something in that moment, it might lead to an argument, or it might lead to this one. So you want to calm down and address the issue at a different time. So breathing exercises are excellent for that, where you sort of calm down your body. And if we go back to the slide of our relaxation response, okay, breathing exercises definitely target the parasympathetic response, where you feel very calm and it slows down your heart rate, it slows down your respiratory rate, right? And your mind will automatically stop the racing thoughts, right, as you breathe. So you can repeat the breathing in and breathing out to the count of 4 for as long as you are feeling stressed, right? So you can do 10 cycles, you can do 15 cycles as you wish. So breathing exercises are excellent and very easy, and you can do it wherever you are sitting. So that's one. And pranayama, if you systematically learn it very well, that's again a breathing exercise which can help you. And progressive muscular relaxation, it is a part of cognitive behavior therapy. So where we teach JPMR, Jacobson's relaxation. So this you can find a lot of videos on YouTube. If you are feeling very stressed, you can as well practice it on your own. And yoga nidra as a part of yoga. So this is a deep relaxation exercise where it has the capacity to slow down the heart rate, the respiratory rate, and make you very conscious, very aware of your body in the here and now. So it also doubles up as a mindfulness exercise where you are focusing on this current moment. And coming to nutrition, do enjoy a nutritious and wholesome diet within the advice of your physician, right? And ask how many times, if you're a diabetic, ask how many times you can indulge in your favorite fruit. Now it's a mango season and the jackfruit season where the diabetics struggle. So you can directly ask your doctor, if you can eat a mango once in a while, right? But don't binge on it and give yourself that leeway where you can enjoy your favorite foods, right? Without feeling guilty. But stick to a wholesome diet on most of the days, right? Do follow doctor's advice in case of chronic disorders. So it's very important because chronic disorders can bring disability. So if diabetes is not well controlled, it can lead to target organ damage like poor sight or a diabetic wound or whatever it is. And make efforts to maintain your diet on your own. So what happens in families is that somebody else has to take responsibility for it and, remind for medication, remind for diet, and tell them not to eat something from the fridge after everybody's asleep. Elders who are with very strict adult children, they tend to behave like children, right? So go sneak in some ice cream in the midnight. I have had patients like that. So the adult children are generally very concerned for the parents' health, and the parents are very much like, I cannot enjoy any of my favorite food kind of thing. So arrive at a balance here and make all efforts to maintain your own diet, your medication, and try to learn and gain new skills, especially like managing your medication, reading the prescriptions, asking questions to your doctor. And I would like to advise you here that do not hesitate to ask questions to your doctor, because your doctor has the knowledge and has the compassion to answer most of them, right? And you have the right to know more about your health condition. Many patients do not ask questions. Like, if a person is recommended insulin, they don't want to ask what is the course of the insulin treatment, because many people are afraid of injections. So they won't take it, or they will change the doctor, or they will do something instead of asking straightforward. I would really advise you to maintain a level of assertiveness in your medical consults. Plan beforehand. What do you want to ask the doctor? What are your worst fears? What is the chance of that coming true? What is the chance of that not coming true? Right? Talk to your doctor freely. Okay. So with this, I am reaching the end of this presentation. So this is a quote that I really liked yesterday. Wear your ears with pride like a badge of honor, for you have conquered, you have thrived, and you have survived. Not only that, in your full life, you have managed to bring up children, grandchildren, support many other people in the society. You may have been a teacher, a banker, or any form of worker. So you would have helped thousands of people in your life. So just because you are old, you don't have to despair, because you have had a glorious life till now, and you can enjoy your current years in a responsible and a healthy way, in a joyous way. So I would like to thank all of you for patient listening. So I'll be very happy to answer any questions from the audience at this point.
Thank you, Dr. For that wonderful presentation. Now I request the participants, kindly you may unmute your mic and you can ask your questions or share your experience. Or you may put the questions in the chat box also.
ತುಂಬಾ ಚೆನ್ನಾಗಿತ್ತು ಮೇಡಮ್, ಬಹಳ ಚೆನ್ನಾಗಿ ಹೇಳಿದ್ರಿ. ತುಂಬಾ ಚೆನ್ನಾಗಿತ್ತು. ನಮಸ್ಕಾರ. ತುಂಬಾ ಚೆನ್ನಾಗಿತ್ತು. ವಯಸ್ಸಾದವ್ರಿಗೆ ಹೇಗೆ ಬೇಕು ಅದೆಲ್ಲ ಬೇಕು ಬೇರೆಯವ್ರ ಜೊತೆ ಬೆರೆಯೋದು, ಮಾಡೋದು, ಮಕ್ಕಳ ಜೊತೆ ಹ್ಯಾಂಡ್ ಕೈನಲ್ಲಿ ಕೆಲಸ ಮಾಡೋದು, ಅವಾಗೆಲ್ಲ ಬೇಕು. ನಿಜವಾಗ್ಲು ನೀವ್ ಹೇಳ್ದಾಗ ಸ್ಟ್ರೆಸ್ ಎಲ್ಲ ರಿಲೀಸ್ ಆಗುತ್ತೆ ನಿಜವಾಗ್ಲು ಅದೆಲ್ಲ ಮಾಡೋದ್ರಿಂದ. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್.
Thank you, Girjamba.
Good evening, Doctor. Mutual understanding, one point is very, very essential nowadays, because youngsters and seniors have to adjust with each other. Today's youngsters will become senior in a later date. The joint family system is day by day decreasing due to misunderstanding and not understanding mutually. This is a good discussion by you. Thank you very much.
Thank you.
Thank you. Anybody would like to ask any questions?
I have a question.
Yeah.
I live alone and I'm able to manage so far. And even during the lockdown, I was communicating with my doctors only on the phone because I was scared to go out.
Okay.
And I have a dilemma because I don't know how safe it is. I mean, it's safe in the sense physically I'm in a safe environment, but to continue like this, and when I think of, I went and visited a couple of senior citizen communities, and somehow I don't know whether it was a mental block or whether it was, of course, one of them was definitely very depressing because they had rules like a hostel that you eat at 7:30 and in the morning. So anyway, I ruled that out. And they were in the city. So they were the most convenient ones, but I just could not get used to the idea that one has to live a life where I'm being regimented by somebody else. And I'm a retired professor, and I've had a very good rapport with my students.
Okay.
And I was teaching in Delhi. And now I'm sort of feeling I'm at crossroads in the sense, to continue like this and, or to move. And if I move, somehow there's a block of the thought of making new friends or, how will I do it? And so all this is kind of, bothering me. Of course, I pushed it aside and I don't keep thinking about it, but I know I have to address it at some point.
Okay.
So I just don't know how to handle this,
Right. I think you're able to manage as of now. Did I get that correct?
Sorry, could you be a little louder?
You are managing by yourself till now?
I have to part-time help to come in. One does the cooking and the washing of the dishes. And I put the machine on alternate days and the clothes are dried by her. And I have another woman who does my sweepings for me. So that's more or less looked after.
Okay.
And of course, my banks have been decent enough to send people along so that, I have I can manage that way, and I get a pension also because Delhi University is a central university. And so I enjoy the benefits of having taught full term. So I get a pension. So financially, I'm.
Right. I think you have got time to sort of mull over what you need to do, isn't it? Like take your time and search out for what kind of facilities that you need, and take time to think about it generally, because as of now you have been managing quite efficiently, isn't it?
But you see, every time I try to think of moving out, I think, and most of these places are very much outside the city.
Yes.
While I live in the heart of the city, not that I've been going out. I haven't gone anywhere in the last 2 years, except maybe to a dentist and some kind neighbors taken me in his car, or to have my booster dose. So, but the fact that I know that I'm in the heart of the city itself is a sense of, a feeling that I'm in an environment that I'm familiar with. Yesterday, my neighbor across the road said, I'd like to give you an Obattu. I said, yes, thank you. So she brought me one, and so these are the kind of things which are, which I think, give me a sense of belonging to this place.
Absolutely, absolutely.
So we don't have a very supportive, environment, in the sense we are 12 flats, out of which only 10 are occupied, and a lot of people keep to themselves. And in this COVID times, we've not visited people. It's just been, conversations maybe while you're walking around the compound or something like that,
Right.
Of course, I went to a book club about a month and a half ago. Somebody took me and brought me back, but it's, I don't know how to.
It looks like a major life change, isn't it? As if you're moving cities, and it's like the next life adaptation. If you're moving into a facility, then it's definitely there will be a time of adaptation. It's not going to be easy. But I'm glad that you are managing very well as of now, and you do have the time and resources to slowly think it over, mull it over, and make the smoothest change that you can manage. So that's what I feel very happy about. Right. So I can sort of understand that you're talking about a major life change, like, getting married or having children, getting retired, So this is, I say that way.
When I was retiring, and I moved in here with my mother, and she had cancer, and I knew she was going. So I wondered, how will I live alone here? So that time that was a big question mark. But have managed the last 15.5 years, because I took a year off. Of course, I was re-employed. I decided I worked enough. So I was worried about how will I structure my time. Even that settled down, because after a time, I think
it looks like you made a successful transition from work life to retirement, isn't it? And there is, again, going by your resilience and your past patterns, I think you will be able to cope, even if you make a major life change in terms of moving out and having to live somewhere else. Not living out of your choice, but if you have to, I'm sure you have the resources to do that. Mental resources.
Excuse me. Can I contribute something here?
Thank you, Dr.
Yes, please do.
This is Yamuna talking. I have had visited a couple of senior citizens who were residing in Nana Nani, facility, senior citizens home. They are doing excellently well. And a lot of people stay there, and there is a demand for further facility, for further expansion. They have phase 1, phase 2, phase 3, and they're going very well. And they have a central dining facility and all other, temple and walking space, etc. Many of them are very happy. Okay. And this senior, gentleman, I think you can think about moving into a facility where you will meet your own age group people, and it will be so easy to relate to each other's experiences. And, you can spend time together, and I'm sure that you will have good time. And staying alone is little tough.
But where is this Nana Nani thing?
It's in Coimbatore. I'm Coimbatore.
Sorry, where is it?
Coimbatore.
Coimbatore in Tamil Nadu, ma'am. Doctor, can I just intervene? I am Jampunathan. I am Jampunathan.
Right, Mr. Jampunathan.
Yeah. Thank you, doctor. See, your session was wonderful. See, I mean, contemplating on the problem just mentioned by one of the US, I just read one article recently. Supposing you are expecting a baby in your family. Okay. Are you not ready to welcome that baby? You do not know really how the baby is going to look like. You do not know how the baby will behave with you. You do not know anything about that. But still, you are expecting, you are always satisfied, you are welcoming the baby. Similarly, in fact, I read in one of the articles, especially a person who likes to move into a society like this, where there is a major displacement or replacement or moving away from one situation to another, one location to another location, please start liking that place even before moving. That will solve the problem to a very large extent. But I do not know how, as a doctor, you view this. But this is what I have read, doctor. I don't know whether, I think this will help. Do you agree?
Definitely, definitely. Definitely it can help, sir. Thank you for this amazing example of welcoming a baby. I don't think even I could have come up with such an amazing example.
No, Dr. Z, it's not my own. Let me be very honest. I just read it in an article.
Thank you for sharing. Thank you for sharing with all of us.
So in fact, a similarly placed lady was expressing herself. Therefore, the doctor was, see, this is again some contribution from by reading, going through Google, like something like that. There, this was there, and they are very clearly established. See, you are expecting a baby. We have started liking that baby even before the baby arrives. Therefore, have a think that I will be happy there. I have experienced this, madam, because I have worked for State Bank of India. See, one big thing with our working is that every 2 or 3 years we have to go out. And it's always a very big stress. Especially at senior level, going there and working with a completely new set of people, with new attitudes. So, we will always be stressed at that time. Somebody said that you start liking the place even before going there. You will feel you'll be all right. But if you have anxiety, if you go to a place with anxiety, only your anxieties will be. Therefore, I think this similar situation, in fact, I tell you, doctor, yes. Thank you, doctor. I just wanted to share this.
Thank you. Thank you, Mr. Jampunathan.
Dr. Rao, what I wanted to say was, living in Bangalore and relocating from Delhi.
Okay.
So that itself was one big, a lot of question marks, as I told you, about retirement, about living alone without my mother, and so on and so forth. So now at this stage, to go to Coimbatore is, and again, sort of, here I have the doctor I'm familiar with, etc., is something which I cannot even imagine.
Excuse me, sir. I'm not asking you to move to Coimbatore or to Nana Nani. I only suggested that things are good in certain places. Maybe you have to look out for in a place in Bangalore or in the periphery of Bangalore, where you will find similar places to stay. It's just that you'll have to take somebody's help to hunt an appropriate place. That's it. My experience, I only shared it. That's it.
I agree, but there are very many good retirement facilities. where people can be happy without, major dislocation, like moving away from one state to another or something like that. This industry has really gone, it has improved and facilities are available. If somebody needs any support on this, they can contact me always one-to-one. My contact details are available in the chat box. They can always reach me one-to-one because I have been doing this this kind of service to many people. And I am also availing the service. Let me be very honest.
Thank you so much, Mr. Jambanathan. Subhasini ma'am and Yamuna ma'am, thank you for sharing. There is one question in the chat box. I just like to share that. Doctor, we are running out of time, but I think we can take this one. How is stress related to addiction?
Addictions. Is that all? That is the entire question?
Yes, yes.
Okay. So stress is definitely linked to addiction because that can be an initiator. A person may start using alcohol or drugs or any coping mechanisms. Nowadays it is Netflix. Nowadays it is behavioral addictions, not just alcohol and other drugs, but behavioral addictions are also coming up. So yeah, when one is stressed, one would like to deviate the mind from the stressful event. So what they do is to cope with it by by taking alcohol or smoking cigarettes. So definitely it can be an initiator, but for it to progress to addiction, addiction is a technical word. It's a dependence. So something which you cannot live without. You need to consume it every day, and the joy you would get out of a small amount of alcohol, you're not getting it. So you'll have to take larger and larger amounts of alcohol. So we call it tolerance, right? And it becomes a salient feature of your life. For example, if you used to enjoy a walk with your spouse in the park, now after taking up alcohol, you no longer enjoy it. You would rather prefer to drink by yourself and leave your spouse alone. That is a salience. So if a person develops all these features, what starts with stress, if the person goes on to develop all these features, then it is called an addiction. So definitely they are connected, and many people use alcohol and drugs as a coping mechanism for depression, like low mood. So they want to medicate themselves, but not with psychiatric medication. So they can start using alcohol, and gradually it will become a habit. Alcohol will make the person more depressed. So in order to lift the mood, they will drink more alcohol. So it becomes a vicious cycle. And also it can lead to financial problems, more stress, is it not? So they are interconnected, yes. Thank you for the question.
Post COVID, there is a lot of relationship issues because of this addiction. And many of them took medicines, but still it is not, they are not able to overcome those things. That is why I put this question.
Okay. So, sir, are you asking me that how do we handle stress within relationships?
Yeah.
Okay. The pillars of relationship, usually when we encounter couples or families, so we describe a cycle called rupture and repair. So what happens in any relationship is there is usually frequent small disagreements or fights or whatever. That is what we call a rupture. Okay, between husband and wife or father and son or mother and daughter, whatever it is. So when this happens, it is not an abnormality that ruptures or conflicts happen within a relationship. They are completely normal because two different people cannot agree all the time, right? But the skills are needed in the repair. So how you repair it? For example, sometimes some people don't talk at all, isn't it? For so many days. The couple, they don't talk. And when they talk, it will be after 20 days and they will just patch up without addressing what issue caused the communication breakdown. Generally, communication breakdowns are not healthy. So this skill is very difficult to talk about a fight. For example, if you want to talk to your adult son, for example, an aged father talking to his adult son who has come home drunk, right? And the father wants to set a boundary that he cannot do it. So it is very important to choose a place and time to tell the son, in a private way, that what you did was not really conducive for your health, and it is not good that you come home so drunk, right? So this conversation can lead to a fight, can lead to an argument, okay, or also can lead to agreements. The person can end up saying that, okay, daddy, I did a mistake. So it can have various outcomes. Okay, difficult conversations can have various outcomes, but it is very important to have them nevertheless. Whatever the outcomes, it is very important to have them. Okay, so this is called boundary setting for elders, right? And if a daughter keeps coming and asking you for money or whatever, it is very important for you to have practical solutions as to why she's doing that. Second is to set financial boundaries. We cannot support you like this. It's very important to say no in a assertive way, but not a hurtful way, right? And usually relationships work only when both the parties contribute to it. Okay, one party working on it, one party only communicating will not work. The other party also has to pitch in efforts, isn't it? So if that is not happening and the relationship cannot be dissolved, okay, then the final way is to accept that this relationship is like this, and the person has only this much emotional reserve, and this is a limitation of this relationship, right? For example, if two spouses, they want to go to the movie, one spouse wants to go, one spouse doesn't want to go, right? So either we have to make we have to reach a conclusion, mutual conclusion, or one of them have to accept that this is not going to be possible. So if I want to watch movies, probably I'll have to go alone, isn't it?
Okay.
So.
Okay, thank you, ma'am.
Thank you, sir.
Thank you.
Thank you, sir. Thank you, doctor. I think we've completely run out of time. I think if anyone else has any questions, you could write back to us, and we would try and answer your questions. Meanwhile, in the chat, we have put a link for a feedback. If you can just click on that and give us your feedback, we would be really grateful. Also, the Vayomanasa, the details of Vayomanasa have been put up. You have a WhatsApp contact number, you have the YouTube link, the Facebook link, etc. Just make a note of it or just click on it so that you have it with you even after this meeting is over.
Yeah, thank you, Annie ma'am. So with that, we will end up today's session. So I would like to really thank Dr. Vasudha Rao ma'am for that wonderful and detailed presentation. I hope you had really covered almost all aspects of stress in elderly. If any of the participants are having any questions, you may write us to our email. We will definitely forward to doctor and get back to your queries. Thank you, Annie ma'am, for moderating today's session, and all the Zoom and YouTube participants who have joined. With that, I would like to thank our partners, Government of Karnataka, Karnataka State Legal Service Authority, Bangalore Apartment Federation, Happy 60 Plus, Samadhana Counseling Center, Indian Psychiatric Society Karnataka Chapter 1, Icon Life Science, REC Foundation, and NSC Foundation. With that, we are ending up today's session. Once again, I would like to thank each and everybody who have joined for today's session. Have a wonderful evening. Thank you.
Thank you, doctor. You did a very informative talk. Thank you.